This is a wonderful patient. She is 6 days out from a lower lid blepharoplasty and a fat transfer. She has minor bruising, but she actually looks great. This is the incision on your skin, and some patients won't have an incision on their skin, some people will. You can see it's right under the lash line, and I'm going to take those out, and then we will show you how to clean those incisions in the next segment of the video. Okay, so to clean your incisions, I like to tell patients it's a 3-step process. Step 1, Q-tip in a cup with some either water or saline. Try not to use peroxide because sometimes that can kind of be uncomfortable for the eyes. I call this the wet step, so you gently clean the lower eyelid incision, taking off any crust. This patient has done a wonderful job cleaning, so there's not much to clean. So that's step 1. Step 2 is to take a dry Q-tip, and I call this the dry step, and it's gently dab the incision free of any liquid that has accumulated from the first step. The third step I call the ointment step. You will have been prescribed an eye ointment, and you take that eye ointment and you gently put it along the incision. This eye ointment is safe to get in the eye. It's okay, it won't hurt your eye, and the whole goal is to keep the incision nice and moist. So putting the ointment on and keeping a moist environment gives you the best chance of having an optimal incision heal after your surgery. So 3 steps: wet step, dry step, ointment step. If you've had a fat transfer, we tell patients not to directly ice the fat, but it is okay for you to ice the eyes. So a lot of patients will put an eye pad or a small 2x2 right on the top of the eye, and you can soak that in ice water soaks and do 20 minutes on and 20 minutes off. And let me show you what that would look like. So our staff will provide you with either iPads or 2x2s to get you started, but you take a small one, soak it in ice water, and just gently place it on the eye the night after your surgery. And we usually have patients do it for 2 to 3 days after surgery. What we want to avoid is having the ice down here over the area of fat if you've had a fat transfer. Okay, next I'd like to go over lower lid massages. This is something that one of your surgeons or someone on our staff will tell you when it's okay to start, but usually it's somewhere around 7 days after surgery. You take the pad of your index finger and you place it right under the incision. You don't want to put it too low. You want to put it right under the incision, and then you look up, and you take it and you bring it up and you hold it there for 2 seconds, and to get an additional stretch you can open the mouth really wide. Go ahead and do that. And you'll feel an additional stretch. That's 1 rep. We usually have patients do 5 reps twice a day in the middle, and then the other place you can do it is at the corner of the eye right here. So pad of the finger right under the incision, slide this skin along the globe or the eyeball and look up, and you hold it in place for 2 seconds, and that's 1 rep.